Hello guys, this is Dr. Murali Bhardwaj, your mentor at every step of your preparation. Let me share with you today 10 insider secrets to crack the All India Postgraduate MD entrance. If at all there are any secrets, purely they are to demystify the myths, the common myths while preparing for the PG medical entrance exam. Now, the first important trick. How long do I need to prepare? Honestly, you don't need a lifetime preparation. 6 months of your honest time, that is 24 weeks, 25 hours per week, because at most 4 to 5 hours a day is what I expect from you. So 25 into 24, 600 hours is more than enough to get the MD seat, doctor. Let me give you a word. Now, a very common uljan in the mind of the students is, shall I attend the coaching classes or shall I not take the coaching classes? After doing a lot of research, we discovered that coaching classes are honestly a waste of time if you are not self-motivated. Though we run a coaching program, I have courage to say that the ultimate yield is not really statistically significant of attending the coaching classes. But one thing is definitely true. Be self-motivated and you take a mock test series which are having the discussions. Definitely that is going to help you as a milestone in your preparation. So there's a reason mock test series, yes, definitely useful. Now, the large versus small subjects. There is always a confusion how to devote the time. So the most important trick number 3 is the 3 large subjects like medicine, surgery and gyne-obs. They need 2 weeks of preparation, and all other 16 subjects, they can as well be finished within 1 week. Suppose if you are taking for a subject like dermatology more than 1 week to complete it, then you are doing some mistake. Maybe a wrong study material or you are reading too excessively. Some reason is there which you need to evaluate. Of course, Harrison or no Harrison is a very important issue. Don't get that Harrison psychosis. Harrison is a waste of time and Davidson is more than enough for MD entrance. Suppose if you have basics. Now the trick number 5. Just reading is not enough. You need to develop the method to recall the concepts like the extraocular muscle actions, branchial arch derivatives, developmental milestones. So you need to develop some method. For example, what is the action of lumbricals? Yes, they flex the metacarpophalangeal and they extend the interphalangeal. So this simple illustration will make you to remember L for lumbrical for a long time. Like that, for every concept you need to develop. What is the secret? What is the way that you are going to recover? Now, a lot of people think just by writing notes or by underlining the books, they get the perfection. No, sir. It's only an obsessive neurotic act. Yes, making notes is sometimes useful, provided you are trying to write down those compulsory revisable checklists like the classification of antiretrovirals, numerical facts, P450 inducers, some such thing which are going to forget, some method to remember them. Making notes makes sense, but making voluminous notes, underlining textbooks, oh, really it is not much of use, is what you need to be quite sure. Of course, as students we have underlined pages and pages, but really not much of use. Then trick number 7. A lot of people are scared about image-based questions. Nothing to scare. Generally, if your basics are good, image-based questions are very easy. The ECG, CD scans, ultrasounds, instruments, histology. If you can recognize what is ST segment elevation, that is more than enough. You can be able to answer the image-based questions on ECGs. So, don't waste much of time about the image-based questions. Now, what is the best method of attending? What is the optimum method? Many people worry about it. The trick number 8 is don't worry about what is the best way to prepare. Some crack the exam sitting in the home and studying. Some by attending the weekend classes. Some crack the exam by going to Delhi, Bangalore, Mumbai, Chennai, staying in hostels and preparing. Some crack only by taking the mock tests. Some crack going to the reading rooms and preparing. Whatever that matches you is the best approach, is what you need to remember. Now the trick number 9, a very, very important trick. Don't waste too much of time on discussion forums, because discussion forums are a breeding ground for spreading the rumors. So don't worry about when will notification will come, will the exam will be there or not. Oh, your job is not to worry about all that. Yes, discussion forums are good to socialize a bit, but they are not the be all and end all, is what you need to be very sure about. Trick number 10, the most important thing. You believe in yourself. Today, you are sitting, preparing with no MD in your hand. Within no time, when you become the topper in the exam, you will be running here and there as a postgraduate in MD first year. A lot of our students like you were sitting once upon a time in a preparation phase, and one time and the present time they are all the toppers. That's the reason the topper is in you, doctor. That's the reason wake up, prepare and believe in yourself that you are the tomorrow's topper. That's most important. And of course, unless you believe that you are going to win, who else can be able to help you out? So friends, prepare well. Of course, all this advice comes with a small ad. And whatever be the support that we give, ultimately how much you prepare yourself. As the mentors, we are all only a medium to provide an ecosystem for you to prepare. So that is what you need to keep in mind. Good luck for your exams.